Abortion before marriage is a complex and sensitive topic that intertwines medical, ethical, cultural, and individual perspectives. It is crucial to examine it through a medical lens, understanding the implications, the procedures involved, the potential health risks, and the emotional aspects that accompany such a decision. The purpose of this discussion is not to promote or stigmatize any choice but to elucidate the facts surrounding abortion, its medical aspects, and its significance in reproductive health, particularly in the context of individuals who may face the situation before marriage. When a person finds themselves with an unplanned pregnancy, the ensuing choices can be overwhelming. From a medical standpoint, the importance of comprehensive reproductive health education cannot be overstated. Understanding how pregnancy occurs, contraception options, and the implications of an unintended pregnancy are crucial aspects of health education that enable individuals to make informed decisions regarding their bodies. Abortion is a medical procedure that terminates a pregnancy. It can be conducted safely in a medical facility or, in some cases, at home with the assistance of medication. There are two primary methods of abortion: medication abortion, also known as medical abortion, and in-clinic procedures. The choice of method often depends on how far along the pregnancy is and individual health considerations. Medication abortion is typically available up to 10 weeks into the pregnancy and involves taking two different medications. The first medication, mifepristone, is taken to block the hormone progesterone, which is essential for maintaining a pregnancy. The second medication, misoprostol, is taken 24 to 48 hours later and causes the uterus to contract and expel the pregnancy. This method is non-invasive and can often be done at home, providing privacy and comfort to those choosing this route. However, it is imperative for individuals to have access to medical guidance and follow-up care after taking the medications to ensure that the abortion has been successful and to monitor any potential complications. In-clinic abortion procedures are performed in a healthcare setting and can be further divided into two categories: suction aspiration, or suction curettage, and dilation and evacuation, D&E. Suction aspiration is commonly used in the first trimester, where a gentle suction is used to remove the pregnancy tissue from the uterus. D&E is often performed in the second trimester and involves a more surgical approach, usually requiring dilation of the cervix before the procedure can be performed. Both methods are generally safe when performed by trained healthcare professionals but do require a thorough understanding of the individual's health history and circumstances. It is important to recognize that the safety of abortion procedures has improved significantly over the years due to advancements in medical technology and understanding of reproductive health. Legal access to these services remains critical, as barriers can lead to unsafe practices that pose substantial health risks. Some individuals may wonder about the psychological implications of undergoing an abortion, particularly in the context of a premarital situation. Research indicates that experiences surrounding abortion can vary widely. Some individuals report feelings of relief and empowerment following an abortion, while others may encounter feelings of guilt, sadness, or anxiety. It is essential to provide individuals considering an abortion with adequate emotional support, counseling, and resources to address these feelings. The decision to terminate a pregnancy is often influenced by a multitude of factors, including personal, socioeconomic, health-related, and relational aspects. In the context of being unmarried, the societal and cultural pressures might further complicate these decisions. Fear of stigma, judgment, or lack of support from family and friends can heavily weigh on one's choice and subsequent feelings about the procedure. Access to comprehensive reproductive health services, including abortion, is a fundamental aspect of ensuring that individuals can make choices that align with their values, health, and life circumstances. In many countries, access to safe and legal abortion remains a contentious issue. Legislation can significantly influence an individual's ability to obtain these services, impacting not just physical health but emotional well-being and socio-economic status. Moreover, the implications of unintended pregnancies extend beyond the immediate decision of whether to continue a pregnancy or pursue abortion. Continued access to contraception and sexual health education is critical in preventing unplanned pregnancies in the first place. Education on effective contraception methods and access to those services can empower individuals to take control of their reproductive health and make informed choices. There is also a notable factor concerning the prenatal care post-abortion. It is critical for individuals who have undergone an abortion, whether surgical or medical, to be provided with appropriate information about their reproductive health moving forward. Understanding one's body, future family planning, and potential complications is essential for holistic health. Post-abortion care should include information about future pregnancy options and family planning methods. Individuals should be educated about fertility awareness, contraceptive options, and what to expect in future pregnancies. This approach not only encourages informed choices but also enhances overall reproductive health and well-being. From a medical perspective, the health of individuals undergoing an abortion is paramount. Complications, while rare, can occur and may include infection, excessive bleeding, or injury to the uterus. Having a qualified healthcare provider who can monitor and manage these risks is essential. Individuals must have access to follow-up care, which ensures that any complications are addressed promptly and that their emotional and physical health is prioritized. While the issue of abortion can invoke strong emotions across the spectrum, it must be approached with respect for the individual's autonomy and the unique circumstances surrounding the decision. The medical community plays a crucial role in providing compassionate care, accurate information, and support for individuals navigating these profound choices. It is vital to create an atmosphere in which individuals can speak openly about their experiences, fears, and hopes regarding abortion. Open dialogue can lead to better understanding, acceptance, and potentially improved policies and practices that prioritize individual health and well-being. The significance of mental health following an abortion cannot be overlooked. Research has shown that the majority of individuals who have abortions do not regret the decision and feel it was the right choice for their circumstances. However, mental health support should be easily accessible to anyone who may be struggling after the procedure. Providing access to counseling services, support groups, and mental health professionals who understand the nuances of the abortion experience is key to fostering healing. Healthcare providers must approach abortion care with sensitivity to its multifaceted emotional aspects. Recognizing the feelings of loss, relief, or anxiety can enhance the care experience, ensuring that individuals feel heard and supported throughout the process. This compassionate approach can reduce stigma and improve the overall experience for individuals facing an abortion before marriage or in any circumstance. In conclusion, discussing abortion from a medical perspective necessitates a comprehensive understanding of the procedures, potential risks, emotional repercussions, and the vast societal and cultural dimensions influencing the decision. Abortion is not merely a medical procedure, it represents a critical intersection where personal choice, health, and societal values converge. A supportive healthcare system that prioritizes education, mental health, and compassionate care is essential in empowering individuals to make informed decisions regarding their reproductive health. By addressing the facts surrounding abortion in a non-judgmental, empathetic manner, we can contribute to an environment that respects individual autonomy and health choices, ultimately enhancing the well-being of those who navigate the complex terrain of reproductive decisions. Abortion is a deeply complex and contentious issue that evokes strong emotions and diverse opinions, particularly when viewed through the lens of religious perspectives. The act of terminating a pregnancy before marriage often ignites debates about morality, ethics, and the sanctity of life, resulting in varied interpretations across different faith traditions. Understanding these religious viewpoints requires a nuanced exploration, recognizing that beliefs about abortion are often intertwined with broader theological principles and cultural practices. Many religious traditions regard life as sacred, and this belief significantly influences their stance on abortion. In Christianity, for example, the belief that life begins at conception leads many denominations to oppose abortion. The Bible does not explicitly mention abortion, but various passages emphasize the value of life. For instance, Psalm 139, 13-16 speaks of God's intimate involvement in the creation of life, and Jeremiah 1:5 notes that God knew individuals even before they were formed in the womb. These scriptures contribute to the view that human life is divinely ordained from the very beginning, prompting many Christians to advocate for the protection of unborn life. However, within Christianity, there is a spectrum of beliefs regarding abortion in the context of premarital relationships. Some denominations, such as the Catholic Church, hold a firm stance against abortion under any circumstances, viewing it as a grave moral wrong. The Catholic Catechism teaches that abortion is a violation of the Fifth Commandment, which instructs against killing. This perspective can lead to a harsh judgment of those who seek an abortion, particularly in the context of premarital pregnancy. The emphasis on chastity and sexual purity prior to marriage further complicates the issue, as premarital sex is often viewed as sinful, leading to unintended pregnancies that are sometimes seen as a consequence of moral failing. In contrast, other Christian denominations may adopt a more compassionate approach, emphasizing grace and understanding for those facing difficult decisions. For instance, some progressive Protestant communities advocate for a woman's right to make decisions about her own body, including the choice to terminate a pregnancy. They may emphasize the importance of context, recognizing that each situation is unique and that individuals may face challenging circumstances that warrant consideration of abortion. This perspective often stresses the need for compassion and support rather than condemnation, encouraging open dialogue about reproductive choices. Judaism presents another dimension to the conversation about abortion. The Jewish tradition generally holds that the preservation of life is paramount, yet it offers a more nuanced perspective on abortion, particularly in cases where the mother's health is at risk. The Talmud discusses the circumstances under which abortion may be permissible, indicating that if a pregnancy poses a threat to the mother's life, the fetus may be deemed less important than the mother's well-being. This view reflects a prioritization of the mother's life and health, highlighting a belief in the importance of individual circumstances in ethical decision-making. Furthermore, Jewish law does not categorize abortion as murder in the same way that some other faiths do. Instead, it is often seen as a complex moral issue that involves weighing the potential life of the fetus against the rights and health of the mother. Many Jewish communities advocate for reproductive rights, emphasizing the importance of personal choice and the need for women to have autonomy over their bodies. As such, the Jewish perspective on abortion before marriage may be more accommodating to the idea of choice, particularly in situations that involve significant emotional or physical challenges. Islam also addresses the topic of abortion with a focus on ethical considerations and the sanctity of life. The general consensus among Islamic scholars is that abortion is not permissible after 120 days of gestation, based on the belief that the soul is breathed into the fetus at this point. However, before this period, there are differing opinions regarding the circumstances under which abortion may be allowed. Some scholars argue that abortion may be permissible in cases of severe fetal abnormalities, maternal health risks, or other compelling reasons, such as socioeconomic factors. In the context of premarital relationships, Islamic teachings emphasize the importance of chastity and the consequences of engaging in sexual activity outside of marriage. As such, an unintended pregnancy may be viewed through a lens of moral failing, complicating the decision to seek an abortion. Nevertheless, there is a recognition within some Islamic communities of the complexities that individuals may face, leading to discussions about the need for compassion and understanding in situations of unplanned pregnancies. Buddhism, with its focus on compassion and mindfulness, offers yet another perspective on the issue of abortion. While there is no unified stance on abortion within Buddhism due to its diverse traditions, many Buddhists emphasize the importance of intention and the potential consequences of actions. The first precept in Buddhism, which encourages the avoidance of harm to living beings, can lead to a general aversion to abortion. However, the emphasis on compassion for the mother's situation can result in a more flexible understanding of abortion, particularly if carrying the pregnancy to term would cause significant suffering for the mother or child. In Buddhist thought, the moral implications of abortion are often considered within the context of the individual's circumstances and the potential suffering that may arise from the decision. As such, a compassionate approach may encourage open dialogue about the challenges faced by individuals in premarital relationships, recognizing the complexities of human experience and the need for understanding and support. The perspectives on abortion before marriage are further complicated by cultural factors that shape religious beliefs and practices. In many societies, stigma surrounding premarital sex and unintended pregnancies can result in feelings of shame and isolation for individuals who find themselves in such situations. This societal pressure can influence the decision-making process regarding abortion, often leading individuals to grapple with conflicting feelings of guilt, fear, and the desire for autonomy. The role of community support cannot be overstated in shaping how individuals navigate the decision to seek an abortion. In some religious communities, the emphasis on family and collective values may create an environment where individuals feel compelled to adhere to traditional beliefs about premarital sex and pregnancy. This pressure can lead to a reluctance to seek help or to discuss options openly, resulting in individuals feeling isolated in their experiences. Conversely, there are also instances where religious communities offer support and resources for individuals facing unplanned pregnancies. Some faith-based organizations provide counseling, educational resources, and assistance to those considering their options. These efforts can foster a sense of community and understanding, allowing individuals to feel supported in their choices rather than judged or condemned. In discussions about abortion before marriage, it is crucial to consider the voices of those directly affected by these decisions. Women's experiences and perspectives are often at the center of this debate, yet their voices can be marginalized in broader discussions about morality and ethics. Listening to and amplifying the experiences of women who have faced unplanned pregnancies can provide valuable insights into the complexities of the decisions and the impact of societal and religious pressures. Ultimately, the conversation surrounding abortion before marriage is multifaceted, encompassing a range of beliefs, values, and experiences. While many religious traditions emphasize the sanctity of life and the moral implications of abortion, there is also a recognition of the complexities individuals face when navigating these decisions. The importance of compassion, understanding, and open dialogue cannot be underestimated, as individuals grapple with the intersection of faith, personal choice, and societal expectations. As society continues to evolve and grapple with issues related to reproductive rights, it is essential to foster an environment where individuals feel empowered to make informed choices about their bodies and reproductive health. This includes addressing the stigma surrounding premarital sex and unintended pregnancies, as well as promoting comprehensive education and access to resources that support informed decision-making. In conclusion, exploring the theme of abortion before marriage through religious perspectives reveals a rich tapestry of beliefs and values. While many faith traditions uphold the sanctity of life, they also recognize the complexities of individual circumstances and the importance of compassion in ethical decision-making. By fostering open dialogue and understanding, we can create a more supportive environment for individuals navigating the challenges of unplanned pregnancies, ultimately allowing for a more nuanced and empathetic conversation about abortion within the context of religion and morality.